I am Dr. Preeti Jindal, Director of Robotic Gynecology of North India Park Hospitals. Today we are going to discuss about robotic gynae surgery. Most of the patients are unaware of the difference between the robotic surgery and the laparoscopic surgery. So what is the robotic surgery? Robotic surgery is a type of minimally invasive surgery which is done with the help of a very high-tech equipment which is known as a robot. In this surgery, 3 or 4 small incisions around 8 millimeters are made on the tummy of the patient, and very fine robotic instruments which are 1/3 of the thickness of laparoscopic instruments are inserted inside the tummy of the patient. Once the instruments and the camera are placed inside the tummy, the robotic arms are attached to these instruments. The surgeon goes and sits on the console, a special chair on which there is a camera fitted, and there are special controls. So the surgeon puts his or her fingers inside the controls, and then as the fingers move, the instruments they move inside the tummy of the patient, and then a surgeon is able to operate inside the tummy with the help of these instruments and sitting little away from the patient. So what is the advantage of the robotic surgery? The advantages are, first, the camera of the robotic surgery equipment is a very high-tech camera. It has got 3D magnification and 10 times zoom. Zoom means we are able to see every organ or every part, every blood vessel inside the tummy very magnified in a 3-dimensional view. So it is just like sitting inside the tummy of the patient and operating. So every artery, every vessel, every nerve is very clearly visible, and so the damage to the surrounding organs or to damage to the vessels is limited with the help of the scope, and surgery is very precise. There is no bleeding and there is hardly any blood loss. Second advantage is, as these instruments are very thin, so the patient has very less post-operative pain. So if we compare on a scale of 10, if in open surgery the pain is 10, in laparoscopic surgery pain is around 5, and in robotic surgery it is 1 or 0. Third advantage is, as there is hardly any blood loss and the vision is very clear, so very complicated surgeries can be done with no blood loss, and chances of infections are very less, conversion to open is very less, and patient is very comfortable. Fourth advantage is that as patient is very comfortable, patient can go home the same day and can resume the normal activities from the next day, and patient does not have to take any holiday or leave or any bed rest. So why this robotic surgery is not done everywhere? First, the robot is very expensive and it is available in very few hospitals. The Park Hospital Mohali has the robot, and I do robotic gynae surgeries in the Park Hospital. Second, as the surgery is slightly expensive, so we should know why is it expensive. It is expensive because the instruments of robot are very expensive. But in Park Hospital we are doing it for very economical charges, and the difference between the laparoscopic and robotic charges are very less in the Park Hospital. Next question is, who all can go for the robotic surgery? So any gynae surgery can be done robotically, and just like fibroid removal, uterus removal, any cyst, and if a patient is suffering from infertility and there is a tubal blockage, the tubes can be opened with the help of robot. If there is a ruptured ectopic, or there is an ectopic in the tube, or there is a tubal pregnancy, then that can be operated with the robot. So any gynae surgery can be operated with the robot. One very interesting question is, patients ask, can baby be delivered with the help of robot? No, because it is a minimally invasive surgery and we make only 8 millimeter 3 or 4 small holes on the tummy. So a full baby cannot come out through these holes. So a robotic surgery as of now cannot be used for delivery of the baby. So these are the advantages of robotic surgery, and everyone who has an access to a robotic surgeon should definitely opt for a robotic surgery, because it is much precise, more patient friendly, more surgeon friendly, and the results are very good. So for any queries, you can contact me at the numbers given below, and I'm sure we will be able to help you. Thank you so much.